Hello and welcome once again to our online fertility awareness program, You and Your Fertility. This is our fertility diet series and today we are at episode 7. Today we are focusing on the fertility challenge as usual and the diets that you can use in managing it. What condition are we talking about? We are talking about uterine fibroids. Today we want to look at uterine fibroids and how you can manage uterine fibroids using diets. Okay, so yes, are there things that you can eat that can make fibroids more manageable, manage it better? And are there foods that you can eat that can even make fibroids worse? That is what we'll be talking about today, so stay tuned. So by definition, uterine fibroids or myomas are non-cancerous masses found on any part of the layers of the uterus, that is the womb. The masses can grow on the submucous region, on the myometrial region, or on the subserous region. These are the 3 layers of the womb or of the uterus. So anywhere we find the mass located, we name the fibroid according to where it is located in the uterus. Basically, more than 50% of women of childbearing age will develop a fibroid at some point in their life. Normally, fibroids begin to decline in symptoms and size after menopause. We'll explain why this is happening. So, some people argue that even more than 50% have fibroids. The symptoms of fibroid include pain. Some women have very severe pain, heavy bleeding during their menstrual cycle. Some people have constipation. Some people have bloating. Some women experience low back pain, and one of the commonest symptoms is frequent urination. Now, there is no single food or single drug, as it were, that can completely eliminate fibroids from somebody who already has it. What we are aiming to establish with this teaching today is that there are things that we can do as individuals on our own that can help to, 1, shrink already existing fibroids, 2, prevent the proliferation of fibroids on the uterus, 3, reduce the symptoms of the fibroids that somebody is already having, and lastly, to slow the growth of the ones that are already established. So we can either plan to shrink the ones that are there, stop the multiplication of fibroids if somebody has already noticed that they have one fibroid, because one of the characteristic features of fibroids is that they can continue to spread and grow, and just take over the entire uterus if it is allowed. But you can prevent that by some of the measures that we'll be talking about today. Then you can reduce the symptoms, these symptoms that I talked about. You can stop the fibroid causing problems for whoever is carrying it. And finally, you can even slow down the growth of the one that is already present. Fibroids grow. One of the reasons they grow is because they are fed by certain hormones. Those hormones, when they are high in the body, continues to, in quotes, feed the fibroids, and the fibroids grow in size and in number. So one of the tricks to achieving any kind of management of fibroids is to tackle the hormones that feed it. And that is why we said that fibroids is commoner in women of childbearing age, and they begin to reduce. You don't notice them so much again once a woman clocks menopause. It is because during menopause, these hormones are no longer as active as they used to be, and they continue to decline in their quantity. Whereas during childbearing age, of course, they are very active, and so the fibroids just continue to grow. But if you can tackle or manage the hormones, that will inadvertently reduce the effect of the hormones on the fibroids. Now you want to ask, for women who are in their childbearing age, are they going to stop bearing children because they are trying to manage fibroids? The answer is no. So sit back and listen to the things that we can do every day to help us manage fibroids. So generally for the management of fibroids, we can come at it using 4 techniques. I want to state that these 4 methods that we are going to use, or we are going to talk about to use in managing fibroids, do not work individually. They best serve collectively. If you use them collectively, you are likely to get better outcomes in the management of fibroids. What are these 4 methods? The first one is exercise. I'm just going to mention them. The second one is applying healthy diet. The third one is using treatment modalities like herbal remedies and some drugs. And then finally, we can use surgical intervention in the management of fibroids. So basically just talk around these other 3. Our focus is on the diet, but we just mentioned the other 3 for completion. So exercise, what has exercise got to do with fibroids? When you exercise, the likelihood of maintaining a normal, steady BMI is higher. Maintaining a steady BMI means you are maintaining a very good weight. And maintaining a very good weight means that you are managing the quantity of estrogen circulating in your system. We have already mentioned a few times that excessive weight, excess fat, produces excess estrogen. So if you don't have excess estrogen, you probably don't have any extra hormone that is feeding the fibroid. I did not mention the hormones that feed these fibroids are basically estrogen and progesterone. They are the ones that causes the increase in growth and proliferation of the fibroids. So if you do exercise, you are likely to reduce free estrogen circulating in the system, and by extension reduce the impact on the fibroids. Another one is use of herbal remedies, organic supplements. Now, organic supplements, some of them have been proven to be effective in the management of fibroids. There are some that we have used as well and have given us very good results. So, but before you take anything, please discuss with your doctor or your care provider and ensure that they are actually healthy for you. Make sure you show whatever you want to use to your doctor or your fertility specialist and let them go through it with you and agree with you that it's something that will be beneficial for the management of the fibroids that you are trying to treat. Finally, surgical interventions. In some cases, either the masses are too large or they have infiltrated the womb so much that nothing else will bring a lasting solution, especially when the symptoms are becoming so bad. Things like excessive bleeding, things like constipation, chronic low back pain, and the rest of them. If these symptoms have become almost unbearable, then your care provider will suggest surgical removal of the fibroids. If it gets to that point, it's not bad, given the sizes and most likely the locations. If it is not going to affect conception, then you can be advised to do surgical intervention and get the fibroids out. That can at least cause you some relief with respect to the symptoms. So our main focus, like we said, this series is about fertility diet. Our main focus is on how you can use diet to manage fibroids. Don't go anywhere. Now we want to start with those foods that you can eat that can help in the management of fibroids. By management, I'm talking about the foods that you can use that can help in the shrinking of fibroids, help in the reduction of its symptoms, and help in preventing its proliferation, that is increasing in the number of the fibroids in the womb. What are those foods? That's what we want to talk about. First on the list are our fruits and our vegetables. We like fruits and vegetables when it comes to fertility issues. How are fruits and vegetables essential for the management of fibroids? Now, when it comes to fruits and vegetables, one of the benefits of fruits and vegetables for the management of fibroid is the high fiber content of our vegetables and our fruits. What does foods that are high in fiber do? One of the things that they do is that they help to mop up excess estrogen in our system and pass them out through stool. Did you get that? So when we consume a lot of fruits and a lot of vegetables, our dietary system is filled with a lot of roughages, or what we call fiber, high fiber content. This high fiber, one of the things it can also do is that it absorbs excess estrogen from the gut. You know, we have said that when you consume excess fats or things that are high in fats, we talk about trans fat, we are increasing the estrogen level in our system. So when we have the high fiber content in our gut, that is in our digestive system, it absorbs this excess estrogen and we just pass it out as stool. So when we are passing it out as stool, we don't have excess circulating in our system that can now feed the fibroids, causing them to grow in size larger, causing them to increase in number, or causing their symptoms to worsen or exacerbate. Another very useful thing for fruits and vegetables is that they naturally help to maintain our BMI. When you consume lots of fruits and vegetables, you are naturally going to reduce in weight. If you are reducing in weight, it means you are losing what should give excess estrogen, and of course the cycle repeats itself. Excess estrogen is not accumulated in the body, is not circulating, and is not free to be feeding fibroids, causing them to grow. So when you eat lots of fruits and vegetables, you will, one, have high fiber that will mop up excess estrogen and pass them out as stool or through the stool. Two, you'll be maintaining the BMI, which means that you're not having excess fat, which will lead to excess estrogen circulating in the system and feeding the fibroids. Another thing that some of these fruits particularly do is that they help to maintain hormone balance. So that also will help to prevent excess availability of hormones that can now be feeding the fibroids. Particularly, these fruits and vegetables are very useful when it comes to management of fibroid, and they include broccoli, they include cabbage, tomatoes, avocado, banana, apples, and citrus fruits. They will do more of this work of creating bulk, drawing out excess estrogen, passing them out through stool, maintaining hormonal balance, and then also helping to maintain weight. And then, of course, BMI and weight, of course. And then these have some other unique micronutrients and minerals that help in regulating hormones as well, help in managing or help in preventing or discouraging the growth of the fibroids. These ones I have mentioned, they also, apart from their work as fruits and vegetables and maintaining a normal BMI, have some certain trace elements and minerals that discourage the growth of fibroids. So yes, fruits and vegetables, but do well to focus on these ones. Another class of food is our low-fat dairy products. Okay, dairy is milk and its products. So low-fat dairy products, these are very rich in calcium, in vitamin D and vitamin E. They can help to regulate hormones. They can help in maintaining a normal body mass index, which is the BMI, which will reduce excessive estrogen in the system. They help to regulate progesterone and remove excessive ones circulating in the system that can now feed the fibroids. Our low-fat dairy products include yogurt, of course, which is rich in these things I've mentioned, as well as probiotics, which controls gut flora and remove excessive hormones in the system. We have things like our coconut milk and our almond milk. These will help in maintaining our hormones and then also controlling the fibroids growth and proliferation. Another class of food are foods rich in omega-3 fatty acid, again omega-3 fatty acids. So we are looking at our salmon, our tuna, oats, okay? These are good. We have our almond oil, our coconut oil. You can use these ones, rich in omega-3 fatty acids, and will also help in the management of hormones and by extension controlling the growth of the fibroids. Then proteins. For our proteins, we want to talk about lean meat, preferably chicken, but if it is red meat, it has to be the very lean cuts. And then of course our legumes, these rich in protein, can also help in curtailing the growth of fibroids. There are some herbs, as it is, or spices that also help in controlling fibroids. Things like our turmeric. Turmeric has been known, adding turmeric to your food has been known to help in shrinking of fibroids and slowing down the growth of the ones that are already in existence. Then there's another herb that is called the burning bush. You can use it to make tea. Then it can also help, that one also helps in controlling the growth and proliferation of fibroids. Of course, naturally, our green tea. Green tea, we have said, if you can try to replace your beverage with green tea, it's very essential for reproductive health. It also helps in the management of fibroids. So we can confidently say that a change in our diet can really go a long way to regulating hormones and, by extension, regulating the metabolism of the fibroids. Their growth and proliferation can help in shrinking them just by changing diet. And then when you incorporate it with things like your exercise, okay, it can really go a long way to managing fibroids and the impact of the symptoms on the system or on our bodies. Now, what are the things that we consume that can be making these fibroids grow more? What are the foods that fuel fibroids in addition to the hormones that we have mentioned? That's what we want to talk about now. It has been known that women who have high level of trans fat in their system, or who are known to consume vegetables and fruits less, have a higher predisposition to developing fibroids. Okay, so what does this tell us? It tells us that foods that are high in trans fat will contribute to the growth of fibroids. Also, people who enjoy a lot of red meat have been linked to having higher cases of fibroids than women who do not focus so much on red meat. So red meat is one other thing that has been associated with increasing the size, the proliferation, and the symptoms of fibroid in the system. So just taking it out of the diet can do a lot, or replacing it, like we said, with leaner cuts. By leaner cuts, we mean removing any excess fat that is found on the meat. So if you want to get red meat, if you have to do red meat, let it be the one that has little or no trace on it, or you just do chicken breasts, which we know do not contain fat at all. Other things that contribute to fibroids growth and worsening of the symptoms is alcohol, of course, processed meat, processed foods in general. So we've said red meat, foods rich or high in trans fat, alcohol, and processed foods generally will contribute to the growth and development and proliferation of fibroids and exacerbation of its symptoms. So just avoiding these things in totality can actually help in the management of fibroids. Even though we have said there are things that you can eat right, you can't be eating the right things as well as eating the wrong things. So taking away the wrong things from our diet, focusing on the right things, and incorporating exercise and probably some kind of treatment will help in the management of fibroids. Foods alone might not solve the problem, but incorporating a healthy diet, like we have mentioned, with other lifestyle improvements like avoiding stress, getting good enough sleep, drinking lots of water, exercising, all these will help to maintain hormonal balance in your system and cause a reversal in the symptoms of the fibroids as it affects an individual. We hope you have been able to learn something from this particular episode. Please remember, learn to teach others. You can view more of these kind of lectures, our fertility diets, on our YouTube channel. Its handle is @love_foundation, or you can just follow the link in the text below and find other videos. You will definitely find something that you can learn from.